Why are we being asked to stay home, or keep our physical distance from each other, or to wear masks? In this video, I'm going to answer those questions. Hi, I'm Sandy Goodwin. I'm a registered nurse and have been for over 35 years. Early on in my nursing career, I was trained in infection control practices, which involve methods to prevent diseases from spreading. Since the coronavirus pandemic began, I found a lot of educational information out there, but one thing I haven't seen is something called the chain of infection. This is a basic model in infection control and something I've taught for years. The chain of infection explains how diseases can be spread. So that's what I'm going to share with you in this video. Because I believe that once you understand how something spreads, then you're better able to protect yourself and to prevent the spread of illness to others. But before we begin, I want to emphasize that what I'm sharing with you is educational information. It is not intended as medical advice. I'm a nurse, not a doctor. So if you have any medical concerns or questions, please contact your doctor or healthcare provider. Okay, let's get started. So this is the chain of infection. Each of the little colored objects there, think of those as links in a chain that are linked together. Now, the chain of infection can be used for all types of infection and is used for all types of infection. So respiratory infections, for gastrointestinal infections, like sometimes people say they have a stomach flu, that would be gastrointestinal. It also can be how wound infections spread. But what I'm focusing on in this video is respiratory infections. So again, the chain is the same for all types of infections, but I'm focusing here on how respiratory infection spreads. So the first in the chain is the infectious agent. This is basically the microorganism. So there are various types of infectious agents or microorganisms that can cause infection and disease. And the two that we're most commonly aware of is viruses and bacteria. Now, the coronavirus or COVID-19 is a virus. Okay, there is differences between viruses and bacteria on how they're spread somewhat, on how they're treated, definitely. So COVID-19 is the common name for the current coronavirus. There have been other coronaviruses. The COVID-19 stands for CO is corona, VI is virus, and D stands for disease. The 19 stands for 2019 when it was first identified in Wuhan, China. So that's what COVID-19 stands for. Sometimes you'll hear the term the novel coronavirus. And novel has nothing to do with books in this case. Novel means new. So the COVID-19 that is a novel, meaning new coronavirus that has not been seen before. So sometimes you're going to see that or hear that about a novel coronavirus. So that's the same thing that we're talking about here. So the first part in the chain is the infectious agent or the microorganism, the bug, basically. Okay. The next is the reservoir. So this is where the organism lives and breeds. Sometimes it's called its host. So in order for any organism to live, it has to have something that it lives in so that it can survive and grow. And that's what a reservoir is. Now, there are various reservoirs, but for the coronavirus here, what we're talking about today, people are its reservoir. So this coronavirus got into a person. How did it get in? They're still looking into that. There's two, currently as of the state, which is mid-April, they're looking at two different things. One, they're looking at whether it spread from somewhere in a fresh market that they had seafood, that somehow it went from an animal into a human there. There's also some question as to whether there was a virus was in a lab in Wuhan, China, and whether it somehow was transferred to humans. But basically, most of these sort of new viruses are what they call cross species. So they started in an animal. In this case, they're sort of thinking bats. because there's some similarities in the RNA or DNA of it, and that they went from a cross species from an animal to a human. Okay, so again, for right now, what we need to know is that this virus, coronavirus, lives in people. It got into the human species. So that's its reservoir. The third piece of the chain is the portal of infection. This is how the organism gets out of its host. So it's in a person. We're talking about respiratory infection here. It's in a person and it has to get out somehow. So how does it get out of us if somebody has the coronavirus or any respiratory infection for that matter? Through a cough, a sneeze, or droplets. We're talking about respiratory droplets, respiratory being your lungs. So somewhere in your lungs, if you cough or sneeze, these respiratory droplets get out. So the portal of exit, they get out of the person through cough, sneeze, or droplets. Once it's gotten out of the person, this organism, in order to keep spreading, has to have a weight that these droplets spread from one person to another. And the two common ways that these respiratory droplets spread is by our hands, and this is pretty much any infection. The main way we spread any infection as people is by our hands. Our hands are not clean. They have some kind of microorganism on it, and we touch things with it, and then that's how it spreads. So the mode of transmission is, where do these droplets end up getting on something that's then going to eventually get to another person? So this is on our hands, and then our hands generally touch surfaces. Now, it's possible that somebody could cough or sneeze onto a surface directly, and that surface would be contaminated. So that's the mode of transmission, how after it got out, it gets spread to something else. So once it's out there, basically, then it has to get in to another person. So if you're around somebody who had something and then, they touched something, or they got it on their hands, they shook hands with you, they touched doorknobs, they did different things, that doesn't necessarily mean you're going to get it. It has to get in you. So how does the organism get into another person? Well, how it gets into us is either by our nose, because we're talking respiratory, our nose or eyes. Basically, we're inhaling it. So is it possible that it could go through your mouth? Yes. If you were around somebody and you had your mouth open and you were breathing through your mouth, and you were around that person who coughed or sneezed or something like that, and it got in your mouth, what would happen is you would inhale it. So this is not something that you swallow. It's not unlike food that you swallow. That's not how respiratory infections spread. They spread by breathing. Now, why your eyes? Because your eyes are pretty much closely connected to your respiratory system. If we have dirty hands, meaning hands that aren't clean and have microorganisms on it, COVID or coronavirus in this case, and we rub our eyes, or our eyes itch, or our nose itches, and we scratch them or rub them, then it can get into us from that way. So that's how the organism gets into us. And I'll explain later how you can prevent this, but hopefully you're starting to get the sense of, oh, that's why they say don't touch my face. Yeah, this is why, because that's the portal of entry. So let's talk about susceptible hosts. So this is the last piece in the chain of infection. So a susceptible host means these are the people who are more at risk of getting the infection, or from having serious complications from the infection, okay, if they get the virus into them. So these are health compromised people, and you've heard some, about this. So we're talking about the elderly. Generally, they're saying people 65 or over is considered the elderly population. Why? Because the virus, the somewhat immunity is your immune system, your antibodies are lower when you're older. Plus, you have other, again, underlying conditions. You're hearing this, and I'm talking about these under this category, where maybe a person's heart is not as strong, their lungs aren't as strong, their kidneys aren't as strong. Bodies have to fight an infection. So it's not just that it affects the respiratory, but it tends to put a lot of extra added energy out of the body. And if somebody is already weakened in another way because of another disease or disorder process that they have, that puts them at a bigger risk of having more severe complications or potential or possible death from getting this particular virus. So elderly is one. Cancer patients, particularly people who are on chemotherapy. Chemotherapy reduces your immune system, reduces your immunity or immune system. Respiratory diseases. So these are COPD, stands for chronic obstructive pulmonary disease or disorder. So these are people who have asthma, chronic bronchitis, emphysema. Any of these are respiratory diseases where it could put the person more at risk of being more, having more of a serious complication if they get the coronavirus. Cardiovascular. So in the cardiovascular system, hypertension, they're finding, is a big cardiovascular risk. So people who have hypertension are more at risk of having problems if they get the coronavirus. Other cardiovascular issues, if you've had a heart attack before, if you have heart failure, all of those create a weakened heart, and the heart has to pump harder and work harder when a body has an infection, because it gets fevers and because it has a lot of things it's trying to fight with the virus. And so that's hard on the heart. Immune suppressed people, people who have HIV or AIDS, their immunity, again, the antibodies that fight things are lower. And so they're more at risk of having more severe complications from getting this virus. And diabetes. So people who have diabetes also tend to have other issues that go along with the diabetes, which is hypertension, which I just mentioned before. They also tend to have cardiovascular issues. So besides the hypertension, they may also are more at risk for heart attacks. Because of that, because of the sugar, basically the diabetes is the high sugar in the blood. And so it can also affect the kidneys. And they're finding, some doctors are finding in their research that kidneys can also be affected with the coronavirus. Again, I think it's just putting the pressure, the strain on all of different organs in the body. So one thing that I want to talk about in terms of health compromised person, and I have an asterisk there, and I have it on the bottom right of this slide, that younger people and those with no underlying conditions have developed severe illness from COVID-19 and even died from it. So they used to think when this started that it was more about the elderly population. It's more that people that have these underlying conditions are health compromised. But the thing is with this novel coronavirus with COVID-19 is we are all really susceptible hosts. Why is that? Because the human race, the human population, and we are all part of that human species, has no immunity to COVID-19. This is why this is such a big deal. And we'll talk about, how to prevent the spread and how to protect ourselves. So really, we're all not immune to this. So any of us really are a susceptible host. And they're finding perfectly healthy 30-year-olds and 40-year-olds and younger people are getting this, and some are dying because, again, it may just be something within that person's body that does this. So we are all susceptible. That's why if you're younger, you're not immune to this. No one is immune, and we are all susceptible to potentially getting COVID-19. So now that you know all that, how can we, sounds a little scary, but a lot of people have already recovered. So it is, I think they say about 95% of people will recover just fine. It's the 5 to maybe 8% are the ones who are going to have more serious. And it doesn't mean if you don't have a serious case that it's not something that's going to take a toll on you. It will, but most people recover. Some people don't even know that they had it. So how can we reduce the spread of coronavirus or COVID-19? Well, we got to break the chain of infection. It doesn't mean we have to break every link. We have to if we break one link, then it doesn't spread. So there's various links that we can break. Some we can't do anything about, some that we can. So let's talk about what we can do here. We can't do anything about the infectious agent. The COVID-19, that coronavirus is out there. Can't do anything about that. Can't do anything about the reservoir. It gets in people. It gets in the human population. Nothing we can do about that. But we can hit those other links. We can break the link of portal of exit. We can break the link of mode of transmission, break the link of portal of entry, and break the link of susceptible host. These are the things we can do. And I'm going to talk about each one separately so you have an idea of what we can do. So let's talk about this chain, the portal of exit. So we can stop this by stopping how the virus gets out of a person. So how can we do this? Again, remember, it's by cough and sneeze and droplets. So if you have to sneeze or cough, cover your mouth. And basically what they're saying is it's better to cough or sneeze into your elbow because these droplets spread. This is also one of the reasons why do we keep this distance? Because generally when the virus is, if somebody coughs or sneezes, it only goes so far. It usually goes to about a 3-foot level, but if somebody was very forceful, it could go almost to a 4 or 5-foot level. So this is why if you cough or sneeze into your elbow, then, this is your inner arm, not the outside of your elbow, but the inside of your arm, then that prevents that from going any further distance. This is why they're telling us to wear a mask. The mask is so that our coughs and sneezes and our droplets are not getting out into the air. It's staying more confined. So the wearing of the mask is protecting others from you. Again, they're saying that there's asymptomatic spread, meaning people who don't know that they have the virus can actually spread it because they may have the virus, but they're not getting big symptoms. Asymptomatic means you don't have symptoms, but it can still be spread. So this is why they're asking us to wear a mask when we're in public so that we're not spreading our germs to other people or keeping our respiratory droplets, whatever we inhale, whatever we exhale, cough or sneeze stays in that mask. And then if you do have to cough or sneeze, please do that into your elbow. If you cough into your hands, now you have it on your hands, and then you need to clean your hands. We're going to talk about that next in the mode of transmission. So if we break the portal of exit of how it gets out into other areas, then the reservoir will stay the person who has it, but it's not going to get in a mode of transmission. It's not going to get to somebody else. So let's look at this mode of transmission and how we can break that chain. So let's say it did get out, the portal of exit. It did get out through a cough or a sneeze or respiratory droplets. Well, as I just mentioned, if you coughed into your hand, go wash your hands, go use hand sanitizer. And I know that's sometimes hard for some people to find on hand sanitizer, but they're starting to be able to, you should start to find it again. I just found some today actually. So there is some, so hand sanitizer, make sure that if you look on the bottle on the back of the hand sanitizer, it says at least 62% of alcohol, ethanol or isopropyl, some type of alcohol should be at least 62% or greater. Actually, it's 60% or greater, but most do say 62 or greater. So hand hygiene is hand washing, washing your hands. No matter what the infection is, if we all washed our hands better and more thoroughly, then we would break this mode of transmission chain. Or link rather. Also cleaning contaminated surface, the doorknobs. After you've been somewhere out, you've been out to get your groceries, essential needs, and then you come back to your car. This is when if you have hand sanitizer, that's when you want to do this. As soon as you get home from being outside, being somewhere else, first thing you do before you do anything else, wash your hands. If you've coughed or sneezed, to protect your family, wash your hands, those sorts of things. That the cleaning contaminated surfaces, and you don't have to have, some of the disinfecting wipes are hard to get. They're now saying you can just use, soap and water. If you've got a little bit of dish soap and water, you can clean those surfaces that way as well. And with this mode of transmission, this is why they're saying to stay at home and to isolate. Because if it's gotten out of you, at least if you stay home, you're not bringing it somewhere else. You're keeping it contained and you're not putting it out into the general public to people who do not have it. So again, we're trying to protect other people as well as, of course, you getting it from someone on the outside as well. Portal of entry. So let's say it got out of a person, portal of exit. It got in a mode of transmission. It got on somebody's hands and they touched you, or they touched doorknobs, or they touched shopping cart handles or ATM machines or wherever you've been. It's gone there. So now it's out there. You may have touched something that has this microorganism in it. How do you keep it from getting into you? Well, there it goes back to the hand hygiene again, washing your hands. And this is why they say don't touch your face. Remember, we talked about the portal of entry in terms of how it gets in by inhaling it and through your nose and through touching your nose and your eyes. So it doesn't mean you can never touch your face. If your hands are clean, you just washed your hands, and they're clean, you wash them well, yes, you can touch your face. But what it basically is saying is don't touch your face unless you know your hands are clean, because this is where you can bring that microorganism to your nose, eyes, or inhale it somewhere and get it into you. This is the other reason for the physical distancing. If it got out of somebody, if it's a mode of transmission, if it's out there somewhere, at least if you're distant and somebody coughs or sneezes, you've got that 6-foot distance between you. It is a lot less likely that you're going to inhale what they just put out into the air, saying that they weren't wearing a mask and they coughed and sneezed and did something like that where it's near you. So if we do good hand hygiene, don't touch our face with dirty hands, physical distance ourselves, then it's very less likely that it's going to get from the mode of transmission into us. Okay, so that is breaking that chain of the portal of entry. And then the final one, the susceptible host. This is protecting the vulnerable people and also really ourselves. And also, again, if you are a health compromised person yourself. So if somebody is vulnerable, older people, people who may have health compromised underlying conditions, stay away from them. Don't bring germs to them. If you have to be in contact with them in some way, you wear a mask, keep that 6-foot distance, those sorts of things. If you're health compromised yourself, have underlying conditions, please stay home and out of the public. Get delivery. If you have friends or family who can bring you something, drop it off at your doorstep, that type of thing. Keep yourself out of the public to protect yourself. And really for all of us, because I mentioned we're all susceptible hosts because we as a human species have not had this. And that's why there's also the risk of going back to work, because we are all susceptible hosts. So stay home except for essential needs. So let's summarize this all. How can we break the respiratory chain of infection? Well, this is all the stuff that I just mentioned all in one slide here. So follow the infection prevention basics. Cover your mouth if you sneeze or cough, preferably into your inner arm elbow. If you did cough or sneeze into your hand, wash your hands, hand sanitize right after it. If you cough or sneeze into a tissue, I didn't mention that. The tissue is now contaminated, throw that away, still hand sanitize or wash your hands. Wear a mask to preventing spreading germs from you to someone else. Now it's a little different in the hospital. They have different kinds of masks that also prevent them from breathing in things. That our basic cloth masks or basic surgical masks are not going to do that, just those special N95 types. So wear a mask to prevent spreading germs that if you were asymptomatic, just basically think of yourself as a carrier, whether you know it or not. Consider yourself a carrier. If you did that and you did all these things, you would not spread anything to someone else. Okay, so wear a mask to prevent spreading your germs to others. Wash your hands, hand hygiene. Wash or hand sanitize your hands. Hand washing is just fine. If you don't have a lot of hand sanitizer, hand washing is awesome, so do that. Don't touch your face. Let me put the little exception, unless you know your hands are clean. Okay, don't touch your face when you're out in public, when you've been around touching things. Don't go rubbing your eyes, rubbing your nose. And then adjusting your cloth mask or whatever mask you're wearing. Be careful when you're out and you've been touching a lot of things and then you're adjusting your mask and putting it around your nose, you're touching your face. So be aware of that, because that's something we don't always notice. Stay home unless you have essential needs. You have to go out to get medication or groceries, but a lot of things are food. A lot of things are being delivered, of course, now. So if you can go that route, do that. Keep your physical distance between people, 6 feet. I think this is a thing that we all want to practice more. I'm still seeing that there are a lot of people that aren't keeping that 6-foot distance. Clean your contaminated surfaces. Again, even soap and water is fine if you don't have the special kinds of cleaning type of wipes, it's fine to use soap and water. So your doorknobs, clean those often. Things in the kitchen, your handles on your sinks, anything that you've been touching a lot. Your TV remotes, your cell phones, things like that. Sometimes we forget about those, and they can be contaminated surfaces. And then protect the most vulnerable people. People who have those underlying conditions may be at more risk of getting seriously ill from this virus. And if you are one of those health compromised people, please stay at home. Let others help you. There are a lot of different ways to get help these days in terms of getting things delivered, having somebody bring things to you. So please don't be afraid to ask or to let somebody know you may need some assistance in this way. If you want more information about coronavirus, I put a couple of websites here. These are the two sort of main ones here in the United States is the coronavirus.gov. That's the main government website for information about coronavirus. And then the one underneath that is the CDC, stands for Center for Disease Control. Those are the doctors and the researchers and the scientists that are specific to studying about disease processes, and our epidemiologists, infectious disease people who were there at CDC to give us guidance. We are all in this together because, again, as I mentioned, we're a human species who have not seen this virus before. So we truly all in this planet are in this together, but each of us can make a difference. So for yourself and for all those that are counting on you. I hope this information has been helpful for you to help you understand why we're being asked to do what we're being asked to do to prevent the spread of COVID-19. If you found this video helpful, please share it, with your family, with your friends, so that they can learn about this too and know how best to protect themselves. Together, we will make it through this. So take care, stay safe, and be well.